Picture an old man named Bezold. He comes into your clinic holding his neck because he has terribly stiff, twisted neck, that is torticollis. Why is his neck stiff? Because pus from his middle ear infection didn't burst outwards where you could easily see it. It burst through the medial inside side of the mastoid. Suppose this is his face and these are the two mastoids. The mastoiditis, because of the mastoiditis, this pus did not drain outwards, it didn't drain this way, rather it started draining inwards, causing sudden pain, fever and bulging neck, fever and sudden pain. First, the core definition to write in your exam, that is Bezold abscess, is a neck swelling that occurs as a complication of acute coalescent mastoiditis, where pus breaks through the thin medial side of the tip of the mastoid. Bezold, from the acronym Bezold, you can remember so many things about Bezold abscess. From B, you can remember breaks through the medial tip. E, ear discharge history is there. The patient will have a history of purulent otorrhea. Z, for zigzags down the neck, the pus travels downwards into the neck. O, for onset, is sudden, that is pain and fever will be there, sudden onset. L, for locked neck, that is torticollis. D, for dual drainage treatment. To treat it, you need two surgical steps, that is cortical mastoidectomy to clean the mastoid and explore the fistulas opening at the tip, and a separate neck incision to drain the neck abscess in the dependent part, followed by the IV antibiotics. So then we have the 5 paths of pus drainage from the from up high to down low. Okay. So this path is least resistance. It is finding the path of least resistant from the high resistant area. First, the pus from the suppose this is the mastoid and it started draining medial side. So from there it started coming to the sternocleidomastoid, pushing it outwards. Sternocleidomastoid is there, no? So it start pushing outwards. That will appear as a neck mass. Follow the posterior belly of the digastric muscle, presenting as a swelling between the mastoid tip and the angle of jaw. Enter the upper part of the posterior triangle of the neck, reach the parapharyngeal space, then track downwards along the carotid vessels. The diagnosis is a CT scan of the mastoid, and neck is the investigation of choice to establish the diagnosis. The two cuts method is that the surgeons will do two cut method, that is up high and down low. Up high is that is a cortical mastoidectomy to clean out the ear and find the fistulas opening at the mastoid tip. Down low, that is a separate incision in the neck to drain the pooling abscess in the dependent lowest part. So let's revise fastly. Bezold abscess. Bezold abscess, there is a neck stiffness, medial side drainage is there, mastoid tip. At the mastoid tip, medial side drainage. Bezold abscess, from you can remember the acronym B for breaks through the medial tip, E for ear discharge history, Z for zigzag down the neck, that is sternocleidomastoid, posterior belly of a digastric muscle, and then posterior triangle of the neck, parapharyngeal space, carotid vessels. One more time. Sternocleidomastoid, you can remember torticollis. So whenever you say Bezold abscess, you will remember the sternocleidomastoid. Now you remember two posteriors, that is posterior belly of digastric muscle, posterior triangle of the neck, and then parapharyngeal space, and then carotid vessels. One more time. Sternocleidomastoid, you remember Bezold abscess, you remember the sternocleidomastoid. Then two posteriors, that is posterior belly of the digastric muscle and posterior triangle of the neck. Digastric will be up, triangle will be down. So it is coming from up to downwards. That way you can remember posterior belly of digastric muscle, posterior triangle of the neck, then two posteriors are over, now parapharyngeal space, and then down to the carotid vessels. So that is the path. And then onset, O for onset, onset is sudden onset of the pain and fever, locked neck, that is torticollis, D for dual drainage, that is cortical mastoidectomy and separate neck incision. So that's about the Bezold abscess.